David, thank you very much for really giving us an update on the really good work that you guys are doing. As you said, there's tremendous complementarity between our work, and look forward to working with you. Questions? Yes.
Hello, David. This is Tim Persons. I'm a PwC partner, and I lead our AI and assurance and then assurance of AI systems. So a broad remit, but great to reconnect with you. And thanks for your talk. Main question is focused on how to achieve that synoptic view between all the sectors, right? You heard Deborah, and maybe you heard Deborah in a previous section, just talking about the various stakeholders and the criteria upon which you might iterate in an innovation system. But do you have any thoughts from the OECD perspective, and having done a lot of studies, how we might achieve that synoptic view across the sectors to align those incentives so that we can get that more holistic innovation and more equitable system that we all want?
Thanks, Tim, and great to see you. Yeah, so I think that in some ways, a hard nut to crack is to get and convene vibrant group of private sector actors. That's been hard for the OECD to do. I think we've done so in the neurotech space, particularly because we've been able to connect with networks of investors and startups and so forth. But I think these communities have to be cultivated a bit, both individually, but then also collectively. And I think these groups are interested and have an appetite for the cross-sectoral exchange. So the neurotech group that we worked with, BrainMind, they were interested in the whole policy arena. They hadn't done sort of policy work or didn't understand sort of policy approaches, and that was very interesting to them. And also the international policy area was interesting. So I think strategic connection to networks of actors, and I think well-designed convenings to get things moving.
Other questions? Yes.
Hello, my name is Andrew Boyd. I'm from University of Illinois at Chicago. One of the questions I have is, as you're dealing with a wide range of international collaborators, you have different baselines of both healthcare and technology. One of the benefits of AI and the emerging technologies is to allow the innovation across all countries and creativity of the scientists and venture capitalists. How are you finding the balance of these frameworks to enable all of the participants to innovate instead of just rewarding the countries with the larger infrastructure and have already advanced further along and used AI to help enable some of the either smaller countries or less infrastructure developed collaborators?
So I'm not an expert to really say in that area, except for the fact that at the OECD, it is a problem. It's understood as a problem of the kind of inequitable access to infrastructure and these things, even across OECD, not to mention the full international set of countries. So I think I think the perception is that ultimately it's to everyone's advantage to be pulled along at the same time. To the extent that especially there might be strong geopolitical counterforces going on. So there's a strong interest in adopting some kind of compatibility across systems. So at least that's how it's being discussed at the OECD. But I think the broader question of beyond AI of what is international cooperation in tech issues when there is such a competition element, and the idea is to find areas where it's not a zero-sum game.
Thank you. Yes.
I would like you to expand a little bit on the concept of neurotechnologies, because my preconceived idea is that if we want to survive AI, we're going to need the red lines. And my red line is a Neuralink. It reminds me a scene from a recent movie called Leave the World Behind, where all the Teslas are driven automatically into the same direction. And so if you put Neuralinks into brains, who's going to tell us, who's going to program them, and who's going to control them remotely? I noticed that in Europe, the culture in Neuralink is much less developed. So what do you think about inserting these digital prostheses into human being?
So I don't have strong views on the technical aspects, but I will tell you that there's a strong interest in inserting a governance system on neurotechnologies, and that's borne fruit at the OECD around this recommendation on responsible innovation in neurotechnology, which the members adopted in 2019. And I think what's interesting about OECD recommendations and maybe generally soft law is that they're seen as ways to forge value-based common principles while allowing countries to continue to operate and innovate so long as they work within those guardrails. And so that's, I think, one of the ways to address the question from the last question as well, is maybe there's a set of mechanisms, governance mechanisms, that can help find that balance that has been invoked throughout today.
Okay, one last question, Gil.
So, Gil Oman, University of Michigan. One area in which there's been quite productive cooperation between OECD countries and the United States for decades is in environmental health, environmental occupational exposures assessment. So risk assessment, risk communication, and risk management, including highly variable susceptibility to exposures to particular agents or settings. And I think there's a lot of lessons we could learn from that for this, as was stated, highly clinically oriented approach today.
Thank you.
Yes, I think there are risk-based approaches, but I think one of the real challenges that the National Academies of Medicine is addressing here is, under conditions of technological uncertainty, upstream kinds of situations, some of our playbooks around risk assessment, environmental risk assessment, might be less effective to try to achieve the kind of social outcomes we'd like to get, and to shape a trajectory of development of technology. So I think we need to be looking at many different models of assessment and be creative, but also understand that we're going to have to invent some new ones. And I think improving or thinking seriously about technology assessments and deepening our capacity for strategic intelligence using foresight, horizon scanning, tech assessment, these sorts of things, I think is going to be a fertile way forward.
David, thank you very much for joining us. We look forward to collaborating with you. Thank you. Finally, we have time for a break. Now, this is in fact a combination of lunch, a quick one, and moving to the breakouts. So breakouts start at noon. You have about 20 plus minutes to do so. So let me first announce the breakout. So the idea is that now that we've heard all this stuff, how do you start using cases? Look how to apply this. So each of the case, we got one on GLP-1 drugs, as you know, which are really important area for discussion, and the other one's on AI and drug design. How do you use these two cases to get into both what Keith Weiler talked about and what Deborah talked about, so they guide you through this discussion so you can see how we can use them. and apply them. And of course, reporting back following that by a broader discussion of everything we talked about today. So let me just give you some instructions. The GLP-1 agonist will be lecture room right here at 12 o'clock. So you can have your lunch here and stay here. The other group, which is AI and drug design, is in room 250. It's not easy to get to, you know. So our staff will try to guide you to go upstairs, go through the labyrinth, you end up with a room which you have breakout. So I would say use your discretion whether you want to have lunch here or bring your lunch upstairs. But those who are staying here, of course, you know, feel free to have lunch here. So we see you, therefore, in 20 minutes. Thank you.